Healthcare in Liberia. The majority of healthcare facilities are run by the government, donors, or non-government organizations, including faith-based charities. Unfortunately, there is a lack of human resources to have an efficient healthcare system, as well as inadequate funding to support healthcare and other basic services. The funding for Liberia's healthcare mainly depends on international donor support due to the poor infrastructure. Liberians traditionally practice gift giving as part of their celebrations. Liberians suffer poor health and nutrition, and this affects pregnant women adversely. The infant mortality rate has reached a staggering 139 deaths per 1,000 births. Families expect children to start helping around the house at a young age. In the most rural areas, children may help their mothers to plant the fields, while in other locales, parents expect them to run errands, look after younger siblings, and do other household tasks. Families arrange marriages, creating social and economic bonds between themselves and other families. Liberia is one of the poorest countries, ranking 177 out of 188 in the UN Development Index. The economy of Liberia is extremely underdeveloped, largely due to the First Liberian Civil War from 1989 to 96. Liberia earns more than 100 million and more than 70 million annually from timber and rubber exports respectively. Life expectancy is 48 years old, access to health is at 69%, unemployment is at 84%, and the country is $3.8 billion in debt. There's an increasing efforts and attention focused on the delivery of mental health services in primary care in low-resource settings. The country has poor physical infrastructure of health facilities, including lack of space for confidential consultation. Other issues include poor communication support, including lack of electricity and mobile phone networks that prevent referrals and phone consultation with supervisors. Absence of transportation for patients to facilitate referrals, negative attitudes and stigma towards people with severe mental disorders and their family members, and finally, stigma against mental health workers. Financing relies on external donor support. Out-of-pocket payments accounted for 35% of total health expenditure. 85% of out-of-pocket payments being paid to private health care providers. Nearly half of the country's total health expenditure is financed by donor money. The U.S. provides essential support for infrastructure development. Liberia is in the process of developing new financial policy for its health system. The President of Liberia has worked hard to create a mechanism that would allow for poor citizens to get the care that they need without worrying about upfront costs. The low-income population that makes up most of Liberia is provided with whatever care that they may need at the cost of the Liberian government. However, with free care also comes classifications on exactly what is covered under it. This has begun to expand as Liberia designs and provides a costing of an essential health services package. Options of social health insurance and a community-based health insurance are also being looked at for this package. Liberia operates on a three-tier system of primary, secondary, and tertiary prevention. Many people in rural areas of the country depend on traditional healers, midwives, black baggers, and traveling medicine sellers. There is a focus on the technical quality of care through physical exams and having an availability of different medications on hand. The system depends heavily on international organ donor support. Healthcare facilities are run by the government, donors, or through non-governmental organizations. There is a lack of medical equipment, physicians, and providers, as well as pharmaceutical supplies. After the war in 2003, healthcare hasn't been able to fully recover, and as a result, Liberia offered free healthcare to those who needed it and continued to aim to keep healthcare costs close to zero. There are many old age homes for the elderly. The senior homes are more affordable living spaces for seniors. Many of the elderly currently living in Liberia experienced the Civil War and lost many of their belongings. The Liberia Conference observes the third Sunday of October each year as Senior Sunday, helping seniors to any resources they need. Despite these resources, many of the elderly don't have easy access to healthcare and medical resources. Veterans petitioned for better mental health care support after the war ending in 2003. Veterans received better health care, but it wasn't guaranteed that everyone would have access to it. Veterans from the official armed forces, the police, and several other government agencies are provided with National Veterans Bureau, which is funded by the government. The National Veterans Bureau is aimed to provide source of income and training opportunities for veterans. The average resident is under 18 years old. Most Liberians speak English as their first language. It holds some of Africa's cleanest cities. It is among the 20 countries on Earth that smoke the fewest cigarettes per capita. There are 16 ethnic groups, tribes that make up the population.